Hello everyone, my name is Martha Law, and today I'll be reflecting on OCD, Obsessive Compulsive Disorder, causes, symptoms, and pathology. OCD is much more than just liking things clean or organized. It's a serious and often misunderstood mental health disorder that affects the brain, behavior, and daily life. This reflection video is about understanding obsessive compulsive disorder, OCD, causes, symptoms, pathology, some personal reflections, the treatment and hope for recovery, some final thoughts, and the references at the end. There is a clear difference between obsessions and compulsions. Obsessions are intrusive, unwanted thoughts, images, or urges that repeatedly enter a person's mind and cause anxiety or distress. Compulsions, on the other hand, are the repetitive actions or mental ritual a person feels driven to perform in response to those obsessions. For example, someone might obsess over germs and feel an overwhelming urge to wash their hands repeatedly, even if they logically know they are already clean. What stands out to me is that people with OCD often recognize that their fears or behaviors are unreasonable, but they still feel powerless to stop them. That inner conflict must be incredibly exhausting. OCD symptoms can vary widely. Some people struggle with contamination fears and cleaning rituals. Others repeatedly check locks, appliances, or light switches because they can't shake the doubt that something bad might happen. There are also those who feel a strong need for symmetry or order. For instance, arranging objects until they feel just right. What is especially eye-opening is that some compulsions happen entirely in the mind, such as silently repeating a phrase or counting. These mental rituals make OCD even harder for others to recognize, which can lead to shame or isolation. OCD can completely take over someone's time and mental energy. The cycle of obsession and compulsion. Obsession triggers anxiety. Compulsion temporarily relieves anxiety. Then relief reinforces the behavior, and the cycle repeats and strengthens. There is a clear biological and neurological aspect to OCD. Research suggests that OCD involves abnormalities in brain circuits connecting the orbitofrontal cortex, thalamus, and basal ganglia. These regions are responsible for decision-making, error detection, and emotional regulation. Basically, the brain's error signal keeps firing, telling the person that something is wrong, even when it isn't. There's also evidence that serotonin imbalance and genetic factors play a role. Many people with OCD have a family history of anxiety or mood disorders. Environmental stress and trauma can also trigger or worsen symptoms. It is fascinating how the combination of biology, thought patterns, and learned behaviors all interact to create this powerful cycle of obsession and compulsion. It is hard to learn how trapped a person with OCD must feel. The compulsions provide temporary relief, but they actually reinforce the anxiety and make the cycle stronger. This highlights how mental illness often involves patterns a person knows are irrational but still can't control. It also reflects how often society misuses the term OCD. People casually say, "I'm so OCD about cleaning," when in reality, OCD is not about being neat. It's about being tormented by intrusive thoughts and feeling compelled to act on them. Understanding this encourages greater compassion toward people who live with OCD. It's not a personality quirk. It's a serious mental health condition that deserves empathy, not jokes. Treatment and hope for recovery. Cognitive behavior therapy, CBT, and exposure and response prevention, ERP, are effective forms of therapy. Medication may help regulate serotonin, and education reduces stigma and increases empathy surrounding OCD. In conclusion, OCD is a complex disorder that involves both psychological and neurological factors. It's defined by the painful cycle of obsession, anxiety, and compulsion, where the person seeks relief but ends up strengthening the very fears they're trying to escape. What gives hope is that effective treatments exist, such as cognitive behavior therapy, CBT, and exposure and response prevention, ERP, which helps people gradually regain control over their thoughts and actions. Ultimately, it serves as a reminder to approach people with understanding and to never minimize what they might be going through. Mental health education like this helps break the stigma and encourages compassion. Thank you for listening and watching my reflection video on Obsessive Compulsive Disorder, OCD. The references used in this OCD video were Osmosis, 2016, Obsessive Compulsive Disorder, OCD, Causes, Symptoms, and Pathology, YouTube, American Psychiatric Association, 2022, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, and the Mayo Clinic, 2024, Obsessive Compulsive Disorder, OCD, Symptoms and Causes.